You must have seen these scenes. You remember that. There's been a lot of complaints about how people are buried if they test positive for COVID-19. There's some new revelations now. The Ministry of Health has realized that bodies don't transmit coronavirus. This is why the Ministry of Health is currently revising the burial protocols after observing that bodies of people who have died from COVID-19 do not transmit the virus. The revision of these guidelines is expected to enable family members to bury their kin in a dignified way. Previously, family members were not allowed to view the bodies of their loved ones or even transport the bodies for burial.
At the onset of the rapid COVID-19 infections in the country in March, the government, through the Ministry of Health, drafted some drastic measures concerning body handling, especially of the victims of the pandemic. At the community level, once a death had been encountered, the family or the community was required to notify the nearest health service delivery point, as well as the county disease surveillance department within the facility and county office. A regional pathologist was to be notified soon after. Movement and handling of the body was required to be minimal, in addition to having it wrapped in a leak-proof plastic bag and labelled. Further, the ministry directed pathologists not to embalm bodies of victims, while insisting that the deceased must be buried within 24 hours. While body bags were required to be zipped up completely to ensure little air goes in or out, health officials were also informed that they ought to disinfect their PPEs with 0.5% sodium hypochlorite or bleach, same as the body bags.
Our cultural practices on how we dispose the bodies of our loved ones may not be practical in an extreme situation.
These regulations meant that family members would not be allowed anywhere near the deceased. Burial of those who died of COVID-19 also meant that very few people would be allowed at the burial site. Family members and Kenyans at large expressed disappointment at how the burial formalities were conducted.
Because we had been told stories of how the grave had been dug before even these people carried the body to the home.
We could not view the body, including, in our culture, we actually must make sure that we secure the body properly, prepare it for burial, and it must be laid in a particular manner.
But 6 months down the line, the Ministry of Health seems to be revising these measures. According to its daily COVID-19 situation report dated 4th September, the main mode of transmission of COVID-19 is via droplets. Hence, family members need to observe basic infection prevention and control while being allowed to participate in a dignified burial for the departed.
We may actually be able to release the bodies to the relatives to go and bury, and as long as they follow the protocols as advised.
The ministry has admitted that the current burial practices under COVID-19 containment measures have been inappropriate and have caused psychological trauma to families. Following these changes, families will now be allowed to give their loved ones a more decent burial, but it is not yet clear how many people can attend the burial of a person who succumbed to the virus. Families could be allowed to view the bodies of their loved ones after the ministry disclosed that there is no danger in getting droplets from the body.
Since we've known that that body, once the patient has passed on, is actually no longer as infective. And as long as you do not get into contact with the fluids, the effectivity may not be that high.
It is expected that transportation of the body to the place of burial will no longer be conducted by health officials dressed in PPEs, as was the norm.
And we hope the protocols, as we roll them out in the course of the week, will probably visit some of those issues and you not see those men in white again.
So far, Kenya has recorded 597 deaths out of the over 35,000 COVID-19 cases. Currently, Kenya is experiencing a reduction in the number of people being tested due to a shortage of testing kits and consequently a reduction in positive cases reported. The ministry has also admitted that it is facing challenges to track all contact cases in the country. It is not clear whether the ministry will revise these changes in case there is an upsurge of deaths or even infections. It is also not clear whether these regulations also apply to bodies that are likely to be transported from abroad into the country for interment. Nimro Tabu, Citizen TV.